Good Monday morning, friends. Excuse my raspy voice today. I think I might be coming down with a sore throat or possibly a cold. But let's see where we are today. A lot of questions we get in the Facebook group called Type 2 Diabetes Support Group pertain to the difference between ketosis and ketoacidosis. If you already know what they are, you might not need to look over this article. But ketosis is a lot of people that follow the keto diet try to get into that state where instead of consuming more carbohydrates, they use the glycogen or the fat that's already stored in their body for energy, and this causes them to lose weight. But as diabetics, we don't need to count our ketones because our main objective is to lower our blood sugar levels. Although losing weight might be a nice side effect. Gotta drink my water. And ketoacidosis is a complication of diabetics. Type 1 usually, but type 2 can also get this. Causes the body to produce excess blood acids. Alright, ketosis is a natural state the body goes into when it uses fats instead of carbs for energy. When the body is burning fat instead of carbs, the liver will turn fats into ketones, or ketone bodies, which then enter the bloodstream and serve as an energy source. Any excess ketones that don't get used by cells will leave the body via the kidneys and urine. Ketosis happens when someone fasts following a low-carb or ketogenic diet. Oh, I forgot to say that this article is from a website called singlecare.com/blog. Ketoacidosis is a lot more serious, also known as DKA, that can lead to a diabetic coma and potentially be life-threatening. It mainly affects people with type 1, but can also affect people with type 2. It happens when ketone and blood sugar levels get dangerously high. For people with diabetes, ketoacidosis is typically caused by not having enough insulin. Thereby, circulating sugar cannot be used by the body for energy. It can be triggered by not following a diabetes management plan, from illness, infection, or from pregnancy. And here's a chart that I thought was very helpful. Ketosis versus ketoacidosis causes. I don't know if I'll go all over these but here is ketosis and over here is ketoacidosis, the causes. And you can see ketosis is a lot shorter. A low-carb diet, keto diet, fasting, intermediate fasting. Ketoacidosis, not enough insulin reaction, illness, infection, pregnancy, missing doses of insulin, not following a treatment plan, alcohol or drug abuse, physical or emotional trauma. All right, let's go down to prevalence. Ketosis, measuring the prevalence of ketones or ketosis is difficult because it's hard to know how many people are fasting or on a low-carb diet. There's been much more research done on how effective ketogenic and low-carb diets are for weight loss. They may be helpful for weight loss more than low-fat diets, and people may feel less hungry on this keto diet. Ketoacidosis, and they list a study showing that the keto diet has potential to help treat epilepsy. Ketoacidosis is a very common complication of type 1. It's the leading cause of death in people younger than 24 who have diabetes, and may be present in 25 to 30% of newly diagnosed type 1. Anyone can get diabetic ketoacidosis, but it may be more common among those aged 30 or younger. 36% of cases occur among people 30 or younger, 27% 30 to 50, and 23% 51 to 70. Some studies show that it's almost more prevalent among women and patients who've treated with insulin injections. All right, ketosis versus ketoacidosis prevalence. Here's another chart comparing the two. So that'll just show you the differences in bullet point fashion. All right, symptoms. Many people will intermittently fast or go on low-carb, high-fat diets to try and lose weight. And even though being in a state of ketosis may have some benefits, it can also cause uncomfortable side effects, like nausea, fatigue, dizziness, headaches, insomnia. Long-term complications aren't well known. Like I said, for diabetics, we don't worry about ketosis. We worry about getting our blood sugars in the normal range, down between 4.6 and 5.6. Using this diet or way of eating. It's a lifetime way of eating. Okay, symptoms. You can look at this if you go to that website. You can see the comparison between the two. Diagnosis. Ketosis is usually done with a urine test or blood test. These tests can tell you what your blood ketone levels are. All right, we're not going to go into all that because this is mostly for weight loss. And the Facebook group that I started, we support eating up to 50 carbs per day, which will not get you into ketosis. Although most of our members without meds need to stay at 20 carbs or less. I stay at 30 carbs or less to stay off of all meds. All right, and here we'll see another chart. And it shows you the blood ketone levels. Treatment. Most people with ketosis don't need medical treatment. It's one of the body's natural states. If you're following a low-carb diet and practice intermittent fasting, stopping these should reverse any adverse effects. And eating less fats will make the body burn carbs instead of fats. So if you're going to go into ketosis, you might experience the keto flu, which should go away after a while. It's dizziness, headaches, low energy, nausea. But after your body adjusts to these lower carbs, those symptoms will go away. Ketoacidosis. People with ketoacidosis need medical attention to reverse high blood sugar levels and high levels of ketones. It's treated in a hospital by professionals who will give you intravenous fluids and intravenous nutrients to replace lost electrolytes and or intravenous insulin. Okay, risk factors. All right, we're not going to look at the ketosis because we don't need to reach that state to lower our blood sugar. The following factors may increase risk of developing ketoacidosis. Type 1, especially those with undiagnosed type 1. Heart disease, pregnancy, infections, illness or trauma, substance or alcohol abuse, missing or not correctly taking insulin. Again, we have another chart, ketosis versus ketoacidosis risk factors. Prevention. So this ketosis tells you to eat more carbs. Of course, when you're diabetic, you're trying to eat less carbs. So you can get into ketosis, or you don't have to, depending on your body and what kind of beta cells you have left and how much insulin, natural insulin, you still have in your pancreas. Let's see, preventing ketoacidosis involves doing several things. People with diabetes can lessen their chances if they follow their treatment plan or the low-carb, high-fat way of eating. Take their insulin, check their blood levels, and check for the presence of ketones if their blood glucose levels are high. How to prevent? All right, we just went over that. When to see a doctor. It's when ketone levels get too high and blood sugar levels rise that people should see a healthcare provider. Now, our healthcare professionals in the diabetes group recommend any reading over 250, you should call your doctor. If you can't get a hold of him, go to the ER and get additional insulin and electrolytes. What are some of the complications of ketoacidosis? Okay, you should seek medical help as soon as possible, because if it goes untreated, it can cause additional health problems and possibly be fatal. Ketoacidosis has been known to cause swelling in the brain, fluid to enter the lungs, kidney damage, coma, low potassium levels, and can even be fatal. Are people with type 2 safe from getting ketoacidosis? There are some ads on here, so just scroll past the ads. Even though people with type 2 are less likely to get ketoacidosis than people with type 1, anyone with diabetes can get the condition. That is why following your low-carb, high-fat way of eating plan is so important. Okay, checking ketone levels. All right, I think that's it. So you can see how important it is to keep your blood sugar levels stable. Even if you can't, you follow our food list religiously and you can't get into the normal blood sugar range, which is 4.6 to 5.6, A1C, or a meter reading of 83 to 120. We should always have a goal of staying under 120. So I think this has been very helpful. Hopefully it has for me. Again, the link is Single Care. Let me see if I can get to the top here. singlecare.com/blog/ketosis versus ketoacidosis /right leaning. I'll have the link in the bottom in the description. Might be a good idea for everyone, even if you think you know everything about ketoacidosis and ketones. Refresh your memory so you know what's happening with your body if your blood sugar rises too fast. You need to get to the hospital. All right, have a great day. Thanks for listening. Please subscribe. I'll have more articles for you and research articles so you can read about what we teach and why we teach it, because we are and have been doing the research. Bye for now.